With diabetes, it is important to monitor your blood sugar every day and to use insulin as needed to ensure that you do not become hyper or hypoglycemic. There are two different types of insulin, regular and NPH insulin. They are both used to lower the amount of sugar or glucose in the bloodstream. Regular insulin is considered a fast-acting insulin and has its onset at 30 minutes to an hour. It is absorbed quickly into the bloodstream and has almost an immediate effect. This is used to control high blood sugar levels during meals and snacks. It reaches its peak effectiveness at 2 to 4 hours and lasts between 6 to 8 hours.
NPH insulin is an intermediate-acting insulin, and it has its onset between 1 and 2 hours. It's absorbed more slowly into the bloodstream than regular insulin. It's most effective between 6 to 10 hours. Because it has a long duration of 12 or more hours, NPH insulin is used to control glucose levels overnight and in between meals. The higher your blood sugar levels are, the larger your dose of regular insulin will be.
There are many factors that can change your blood sugar level and therefore cause the need for adjustment of the insulin dose. The three main factors that would cause adjustment of insulin medications include carbohydrate intake, level of exercise, and hydration, or the amount of water an individual drinks daily. Carbohydrates, which include sugars, starches, and fibers, are one of the main sources of energy for the body. Grams of carbs can be found on the nutrition facts label, but some common foods that contain carbohydrates include bread, milk, potatoes, and juices. When individuals eat carbohydrates, it eventually breaks down to glucose or sugar. The more carbohydrates an individual eats, the more glucose the body will make, and therefore higher doses of insulin are necessary. Exercise is the best way to lower one's glucose levels. During long and intense exercise, glycogen, a type of sugar that is found in the muscles, becomes used up. The muscles must replace their glycogen with glucose from the bloodstream. Since the muscles are demanding glucose, the cells in the body become more sensitive to insulin, causing it to work better and therefore requiring less insulin.
The liver is the organ that stores most of the body's glucose. According to studies, dehydration can lead the liver to release more glucose into the bloodstream. So the less water a person drinks, the more glucose will be released into the blood, and a higher dose of insulin will be required. Other factors that can influence insulin doses include sleep, stress, and smoking. You will know that the dose of insulin is wrong when you start experiencing symptoms of hypo or hyperglycemia. Some symptoms include anxiety, restlessness, fast heart rate, trouble sleeping, and weakness.
Another unlikely adverse reaction to insulin is anaphylaxis. Anaphylaxis is a sudden, severe allergic reaction. Look for symptoms such as rash, shortness of breath, and the swelling of lips and tongue. If any of these symptoms persist or worsen, go to the emergency room immediately. In your next appointment with Dr. Dular, you may discuss any concerns you have with this medication, such as weight gain. Let Dr. Dular know if you feel that the medication is not effective. State whether or not you have been taking your medications regularly. Most important, report any signs and symptoms you may have started to experience from your medications, such as hypoglycemia and anaphylaxis. Please don't hesitate to ask any other questions concerning your health to Dr. Dular.